Hi, I'm Steve Adubato. It is my pleasure to welcome for the first time Dr. Steve Landers, President and Chief Executive Officer of a great organization called the Visiting Nurse Association Health Group. Good to see you, Steve.
Good to see you. Thanks for having me.
Steve, let's talk about the Visiting Nurse Association. What is it?
Visiting Nurse Association Health Group, we're a nonprofit organization that works throughout the state of New Jersey, and we help people in home setting, community setting, really on bad days when the chips are down. Maybe they're trying to get out of a hospital and need extra help. We are trying to help people when they're coming home from surgeries, joint replacement surgery, heart surgery, working to help people late in life, at the end of life, with home hospice care, so that families are supported and people can have those days be as comfortable and have as much independence and dignity as possible.
Tough situations, right?
A lot of hard situations, yeah. We're doing a lot of things that people don't like to think about and talk about, those tough days in life, maybe days when you're in the shadow, but family caregivers are working with their loved ones. We have nurses, therapists, social workers out there making hundreds of thousands of home visits a year in Jersey, helping people at those times.
And you actually, by way of background, a family physician, geriatric medicine?
That's right.
Explain that to folks. What does that mean, geriatric medicine?
Geriatric medicine. I'm an elder care specialist. There's actually an advanced specialty of physician training where you can become more knowledgeable about treating older adults. People, they say over 65, but quite frankly, most people that need geriatric care are 85 and above. It's a big growth population, as you know, nationally because of the demographics. Absolutely. Overall,
living longer.
People are living longer, but with the baby boomers, the aging of that generation is really, thousands of people a day are becoming 85 and older. That population is going to triple over the next 30 years. So we've got to, as a state, as a country, really make sure that we're able to help.
How'd you get into it? Why do you care so much about this particular population and the challenges they face?
I'm a family doc originally, and
From
Cleveland. That's right. I grew up in Cleveland, Ohio, and did my medical training in Cleveland, Ohio. Worked at a Cleveland clinic, running their home care, and
not a bad place,
and working in their geriatrics group. And what I learned, when I was in medical school, quite frankly, is that older people, their families, are often not tended to, particularly in the home setting where they want to be. They want to be home if they can. I started making home visits, brought the black bag.
You did?
Did over 5,000 home visits to frail elders, and I'd show up at the door, and the family caregiver would sometimes almost break down just in gratitude that somebody was helping them out, because they're having a tough time. If you're dealing with a loved one with Alzheimer's disease, Parkinson's disease, or stroke, or bad heart disease, and you've been bouncing around, gone to the hospital, maybe in a rehab facility, it's hard. It's hard for the person and the family. And so I realized really quickly there's so much need.
Yeah. There's all kinds of disclosures I make about relationships we have, but this one is a particularly challenging one, but I also need to thank you and your folks. My family does too, because the Visiting Nurse Association has been caring for my dad through hospice, who's been dealing with some really challenging issues for a while now. And I would not have known. I mean, we've done programs on hospice care, but it was hard for our family, for me personally, to really understand what that care was until those nurses and the other clinical professionals came in to do what they were doing, particularly for my mom, who's really been charged with the most responsibility with my dad. It's extraordinary.
It's really incredible, and it's not talked about a lot, not talked about enough. And hospice, the thing is, hospice is more care, not less. When people
think right away, people like, oh, so this is it.
That's right. The gut, sort of the knee-jerk reaction is that we've given up. There's nothing left to do. And the fact of the matter is, there's a lot we can do for people with serious late-stage illness when other medical treatments aren't working. We can help make sure that they're not in pain. We can make sure that people have the social support they need with the basics of life. The personal care issues. We can make sure the family's supported and has the right help and equipment in the home. We can help people tend to some of their spiritual issues. Actually, part of hospice care includes pastoral care, and we have reverends and rabbis as part of our staff. So there's a lot,
workers, they're all there.
Absolutely. There's so much we can do to help people and provide more care, not less. And ultimately, at some point, death is a part of life, and making sure that we help people and families have the most dignified and supported situation, I think, is an important thing, and I'm proud to be a part of it.
Steve, what is the 2020 Vision Campaign?
The 2020 Vision Campaign is an effort by Visiting Nurse Association Health Group to raise money for our philanthropic services. These are things like what we call Advanced Care Institute. This is palliative care, hospice care, and home visiting physicians. We actually have 30 physicians and nurse practitioners that are doing home visiting medical care in the state of New Jersey. It's a hard thing to get up and sustain, and the support that we're getting through the 2020 Vision Campaign is helping that go. Another area we haven't talked about yet that Visiting Nurse Association is very involved in is actually children's health care. Many children that are dealing with things like developmental issues, autism and other developmental spectrum concerns. Maybe they're in socially vulnerable situations in high poverty neighborhoods. We have nurses and community health workers that go out and work with those families, trying to make sure that they get the type of services that they need, make sure that they're on a path to have, basically accomplish as much in life as they can. They're working with pregnant women in high poverty neighborhoods, trying to help them be in a safe situation where they're less at risk for domestic violence and other bad outcomes. That's our Children and Family Health Institute.
What is the Connective, help me on this, the Connective Health Institute?
That's right. We have
Connected Health Institute.
Connected Health Institute.
Give me 30 seconds on that.
Yeah, the Connected Health Institute is an effort of ours to use mobile and digital technology to do all the things we've been talking about better. So we feel like if we're going to be great at home health care for older people, hospice care, children and family health services, we want to use that modern information technology, video conferencing into the home, apps so that people can access us off hours, better communication between our staff, remote monitoring to the home where people are having their vital signs, the blood pressure checked, their weights checked if it's relevant to their care remotely. Our Connected Health Institute, which is part of that 2020 Vision Campaign, is where we're really innovating to not just provide all of the things we know that are important about home care, but also to find ways to do it better and to innovate.
Dr. Stephen Landers is the President and Chief Executive Officer of Visiting Nurse Association Health Group. Steve, I want to thank you for joining us and you and your colleagues for what you do every day for so many people who need that help. Thank you so much.
Thank you.
Right there. We'll be right back right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by Johnson & Johnson, Choose New Jersey, PSE&G, Kessler Foundation, New Jersey Sharing Network, the New Jersey Office of the Insurance Fraud Prosecutor, and by Gary's Wine and Marketplace. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.